Ever since I started this practice, the Healing Sanctuary, I've had a lot of patients come to me with chronic autoimmune disease and autoimmune disorders. In my training and through my research and investigating different articles, we know that there's a high collaboration for autoimmune disease from chronic infection. One of the most common ones that we find, and also other researchers and scientists have found, is chronic Epstein-Barr. It's very common, and I check it in all my patients who come to me with fatigue and autoimmune disease and arthritis, and I find it often, probably about 80% of the time, to be the cause for their inflammation or flare-up with their autoimmune disorder. So we do blood work to verify that, and we find it sometimes just off the chart. And what that means is that people can get Epstein-Barr when they're young, which is mononucleosis, and that virus becomes dormant, and then it comes back. And something with the immune system is compromised as you get older, and when it comes back, guess what? You get autoimmune disease, you get chronic fatigue, you can get arthritis, you can get brain fog and those kind of things. And the other thing that we also find, and the researchers have found, that it's also related to lupus, and it's also related to multiple sclerosis. And so we focus on the root cause, and many times that's what it is. It's a chronic viral infection, very similar to shingles and chickenpox. It's a great analysis or metaphor. Shingles and chickenpox. Chickenpox is when you get it when you're little and you get a chickenpox rash, but when you're older it comes out in a small rash called shingles. It's the same virus. It was dormant your whole life and it came out. This happens with Epstein-Barr. It happens even in young people, it happens in the old people particularly, and the longer it's there, the more likely it's going to cause your autoimmune markers to be positive, and it's going to continue to cause havoc. And so we focus on the treatment of getting at the root of it, and we use different therapies that are natural to get at the root of the infection. Epstein-Barr, cytomegalovirus, we see a lot of Lyme as well as potential causes. So look into the science. You can look on the internet and you can find that there's many research articles that point that autoimmune disease is highly correlated with chronic infection, particularly viral infections.